Good evening, everyone. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health to look beautiful and smart at all times as quest of humans, right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern, especially for women in their 20s. However, it would be wrong to say that men don't suffer from acne. To many, acne is also known as blemishes, blackheads, whiteheads, pimples, or cysts. It is most common during puberty or adolescence. According to a recent data, almost 80% of people in the age group of 11 to 30 years have acne breakout at least once. Although acne most commonly does not have any serious health concern, but is de-stressing for the sufferer. The faster the issue is diagnosed, more effective will be its treatment. Thus, knowing about acne management from an expert is essential. For this, today we have Dr. Roopal Bansal with us, a consultant dermatologist and dermatosurgeon from Noida, live with us to educate us more on acne management. Dr. Roopal is director at Dr. Roopal's Skin Clinic, Noida, consultant at Jeevan Anmol Hospital, Mayur, Vihar, and consultant at Kailash Hospital, Noida. Dr. Roopal has more than 10 national and international publications on her name. With her expertise in today's topic, Dr. Roopal will enlighten us on management of acne. A very warm welcome to you, Dr. Roopal. We are really looking forward for this session with you.
Thank you so much for having me. And I'm excited to talk about acne and share my views about what I can share on acne and acne management. Thank you.
I'm sure this session is going to be a very informative one, and it's a pleasure to have you indeed with us. So, to begin with, Doctor, we would first of all like to know what is acne, what are acne, and what causes it.
So acne is a disease of the pilosebaceous glands, which are the oil glands basically, which are present over our skin, shoulders, back, and especially on the upper part of our body. And acne is caused due to four reasons. There are basically four reasons that lead to the formation of acne, and mostly it starts at the teenage time when there is a change in hormone profile. At the time when we hit puberty, there is a change in hormones, and those hormones lead to various changes that eventually result in acne. And at least you'll see around 80% of the whole population would have had acne sometime or the other during their lifetime. So acne is a very common issue, and it affects mostly all of us. All at one time of the other of our whole lifetime will be affected by acne. So first of all, the changes that occur in acne, first is there is clogging of the pore. The pore through which the natural oil, that comes out into the skin, that pore is clogged. Second is there is increase in sebum production. Sebum is the natural oil that comes out through the oil glands in our body, and not only the sebum production is increased, sometimes the constituents of the sebum are uh, changed in such a way that one of the fatty acids is increased, other one is decreased, and that results in formation of acne. Third is infection with the Propionibacterium acne. It is a bacteria which is naturally present in our oil glands, but it somehow proliferates, it eats on the sebum, and it leads to acne. And the fourth reason is inflammation. Because of all these processes that is going on, the clogging of pore, the increased sebum production, the bacterial infection, all these lead to inflammation. There are a lot of cells that come there and lead to the formation of acne. So these would be the microanalytics of what happens inside our pilosebaceous follicles, and that leads to acne formation.
Right. Many times people say that with excessive heat or humidity, it's, becoming even worse. So can heat cause acne breakouts?
Yeah, definitely. There is an entity that is typically known for its heat causing acne, that is tropical acne. So a lot of heat and humidity, they not only increase, they have effect on the amount of sebum production, but also they lead to clogging of the pores. And as you know, clogging of the pore is the first step in the formation of acne. So yes, This is not the only cause. There are many other trigger factors that can result in acne formation. But yes, heat and humidity will increase the acne formation in the people who are already prone to acne, those who have acne prone skin.
Right. And these days, as mask is new normal for us, again, people are complaining about acne, especially in the area which is covered by the mask. Now,
Yeah.
why that is happening, doctor?
The same reason, because we cover the mask, and whatever air that we're exhaling out, it gets trapped inside. So not only the bacteria, they get a fertile ground to grow, but also there is a lot of buildup of humidity. So the humidity again, it clogs the pore and leads to acne formation. And we have a very special name for that, that is maskne. So we find a lot of acne that is only on the covered area of the face, and mask does lead to acne formation. Yeah.
Right. Doctor, we often say that prevention is better than cure. So, any way to prevent acne breakouts?
It's not possible to completely prevent acne or formation of acne, but yes, there are various methods that if we follow, we can not only reduce the severity of acne, we can reduce the side effects, or basically sequelae, the long term and short term complications that can occur with acne. So those steps would be, first, to follow a good skin care regimen, like washing your face with a good pH balanced cleanser or a sebum controlling cleanser that contains salicylic acid, so that the excessive sebum production is taken care of. Then, not using any harsh products on our skin like scrubbing or any other facial massage activities, that again can lead to increased acne formation. Always taking care of the dandruff, because dandruff is a very important cause and it is mostly ignored. So people who have dandruff, they tend to get acne over the forehead or maybe on the hairline, wherever the dandruff tends to fall. So it's very important to not only treat the face but also the scalp issue if there is any, and be mindful of whatever we are putting on our faces, because we don't, most of the makeup products and other cosmetic products that we put on our face, if those are oil containing, they'll again lead to increased acne tendencies. So if you have, and also diet, so if we are mindful of whatever we are putting in our stomach, like more glycemic, the high glycemic index foods like sugars, fried foods, and especially the medicines.
Okay.
Many people are also taking many kind of medicines. So all these trigger factors, if we take care of, we can sometimes prevent the acne altogether. But if not prevent, at least we can reduce the severity and the sequelae of acne.
Fair enough. And doctor, is it true that even milk and dairy products also aggravate the acne breakouts, or it's just a myth?
No, there are some studies that say that especially the milk that is available nowadays, the most of the dairy products are hormonally modified.
Right.
So the hormones that are present in the milk, they have effect on our body system, and there is increased level of growth factor known as insulin like growth factor, and that eventually leads to more acne formation. So yes, dairy products there are studies which indicate that dairy products does increase acne formation, and those should be avoided in patients who have acne prone skin.
Right. Now, most of us associate acne with teenagers or during puberty or adolescence, but again, there are adults as well who complain of acne. Many women's, during menopause or even before that, they'll come and say that, I'm having these acne. I never had acne in my life, but now I'm having it. So, does acne occurs in older ages or even adults go through the phase?
Yeah, definitely. Acne is predominantly a disease of teenagers. It is very common during teenage time when there are changes in hormone. But as we understand, because it's a disease of hormones, so if at all there is any condition that is leading to any kind of hormonal imbalance later on also in our lives, like during in 30s or 40s, that can again lead to acne formation. And a very common cause of such kind of adult acne is hormonal acne. So we've heard of the disease of PCOD, polycystic ovarian disease. So the females who suffer with this disease, there are multiple cyst formation inside the ovary, and along with these cysts, there is a change in the complete hormonal profile. Some hormones like testosterone they rise, and some hormones are on the lower side. And the overall effect of these testosterone is that there is increase in the overall acne formation and acne tendency, along with then many other symptoms like the adult onset acne would be more on the lower phase. It would be associated with menstrual cycle, like 1 week before the periods, the lady will experience a flare up of acne, and there will be associated hair growth. There will be some maybe hair fall. So, adult onset acne is mostly hormonal in nature, and not only we have to treat acne in those cases, but we also have to take care of the internal hormonal condition of the patient.
Right. So it's also important to go and consult a doctor in case of acne, because it's just not about the acne, it's also about the underlying causes. It's also about diagnosing the cause.
Right.
And thus, I would like to know and understand, doctor, many a times with acne specifically or any other skin condition, we love doing home remedies. We love going for over-the-counter medication, asking the chemist, "Bhaiya acne ho rahe hain, kya kare? Koi cream bata do." Or what our family or friends have done, we would like to do the same thing, but won't go to the doctor unless it gets really bad. Now, how do you address this issue? I mean, is taking home remedy or over-the-counter medication, etc., okay, or we should immediately go and consult a dermat?
No, I strongly advise against taking any over-the-counter medicines, because uh, most of the over-the-counter medicines they contain steroids, and steroids might give a temporary relief in the inflammation and the redness part, but in long term it eventually increases the acne formation, and it can further harm your skin. And the treatment of acne also depends on the stage of acne that you're having. Sometimes the acne is very mild, it's only comedones, predominantly comedones are there. So that kind of acne needs another kind of treatment. And sometimes the acne is very severe, and there are a lot of large nodules and cysts over the face. And that kind of acne needs completely different kind of treatment. So it's always advisable to visit a dermatologist, if not in person, at least in through a video consultation, and then start your treatment accordingly. The only thing that the person can do at home, back at home, would be to use good good kind of the how I explained just earlier, good cleansers, mild cleansers, and not at least use things that are harmful on your skin. That would be care enough for taking care of your acne at home, and rest should be left to the dermatologist, to the
And
specialist.
what about home remedies? Because that's the first thing we do with our skin, home remedies.
Home remedies, some part of the home remedies are okay to work with, like multani mitti is okay. That takes care of the sebum production at some level, that is fine. But rest of the home remedies won't be effective enough for the treatment of acne. Maybe for the prevention, those are fine, but not for the treatment.
Right. And as we said before, that it's important to diagnose the cause, and only an expert, a qualified dermatologist can do that. Thus, it's important to go and consult your doctor before doing anything else, unless we keep on, worsening our condition. And by the time we land up in front of a doctor, it's way too late, or the treatment gets very lengthy. So if you want to cut on your treatment energy, money, right, you need to go and consult a doctor. Yes, doctor.
Yeah. Also, I'd like to add that once the acne has progressed, and the earlier we treat, the lesser are the chances of complication. So after acne, we very commonly see that there are multiple pit-like scars or very deep depressions over the skin, and those occur whenever there are deeper acne. So if the acne has been addressed earlier, only in the initial stages, there are lesser chances and lesser tendency of any kind of long-term complication or long-term scarring formation. And as we keep on delaying our process and keep on applying home remedies and keep on waiting for the home remedies to work, the acne might worsen. And not only the acne takes time to get treated, but also we have to suffer from long-term complication and acne scarring, and which are many a times permanent, or at least some of the mark are left. So better to get them treated at the first and the initial stages only.
Right. And as you said, it's very important to follow a healthy skincare routine. And you said a gentle cleanser is very important. Now, the thing is, we would like you, A, to shed more light on very basic skincare routines, especially for people who have acne prone skin. B, many people, especially those who have oily skin or those who are acne prone, they end up washing their face with face washes or cleanser n number of times, thinking that by that they'll actually restrict the oil formation, etc., and this will make their skin free of acne. So how healthy that practice is, and of course more light on a very basic skincare routine for acne prone people.
Yeah. So the skincare routine for acne prone skin, or especially people who have oily kind of skin, would be first to use a gentle salicylic acid based cleanser. So salicylic acid and other AHAs like glycolic acid, they help in reducing the amount of excessive oil from the skin. So they will take care of the excessive oil that is coming out from your skin, and they should be gentle in the sense that the pH should be balanced to your skin. And the
Mhm.
cosmetic cleansers that we have that are available in the market, they are mostly alkaline. So alkaline cleanser would harm your skin, and what we need to see in our cleanser, that the pH should be balanced and it should have salicylic or glycolic acid that would take care of the excessive oil production. Second thing that we have to take care is always moisturize your skin. The moisturizer should be definitely water based and not oil based. But yes, moisturizing is very important. People with oily skin, they tend to omit this step. They think that their skin is already very oily and there
Mhm.
is no need to moisturize. But this is where we are wrong. Uh, After when we're not moisturizing our skin, it sends a signal to our oil glands that it needs moisturizer. It's getting dehydrated, and that leads to excessive oil production. So once we have put a good water-based moisturizer, the oil glands, they won't produce excessive oil, and that will further help with acne formation. Third would be to apply a sunscreen. So,
Okay.
because whenever there is any issue on our skin and we are undergoing treatment also, so the skin is even more sensitive to any kind of solar damage. And or there is also a tendency, so whenever there is any pimple or acne formation, when it is healing, it heals with a brownish or reddish spot. And the tendency of that spot formation can be reduced only if we have a good kind of sun protection. So third point would be to always apply a good sunscreen, water-based or gel-based, preferably as your daily skincare regime. And as a night cream, we also have to apply a retinol-based preparation that is to be applied in a very pea-sized matar ke dane ka amount. We have to apply all over our skin. So that will take care of the small bumps, the comedones that happen, and which are the first stage of acne formation. So this would be a regimen and sufficient regimen to be followed at home. Uh, Proper cleansing, moisturization, sunscreen, and a nighttime gel.
Yeah. And what about the second part of the question, that many people go on washing their face with cleanser or face wash, etc., assuming that it will make their face oil free and thus acne free.
So, if in spite of using salicylic acid and glycolic acid face wash, the person is still feeling that the face is getting oily, then they can under repeated washing will rather harm their face. Repeated
Mhm.
washing is not at all advisable. 2 to 3 times per day is sufficient. Washing their face, and every time after every time washing, they should always apply a good moisturizer. And uh, even if after that, after washing their faces so many times, they feel there is excessive oiliness, they can go on for treatments like peels. They can go for peels, they can go for laser treatment, they can go for some oral medicines that will take care of the excessive oiliness. But washing is not the solution. Washing is rather harming their skin.
Okay. Now we'll also talk about the treatment part little later, but now, right now, we would also like to understand, as you said, that sunscreen again is very important, especially even for acne-prone people. Now the thing is that people who have acne or whose skin is, more prone to acne, they often say or complain that by putting sunscreen, they tend to sweat a lot, or they feel a lot of oil on their face after applying sunscreen, or their face feel very patchy or dull, etc. Thus, they don't use sunscreen. Now, how would you like to address this issue?
Yeah, this is a very common complaint, and most of the sunscreens they do tend to cause a bit of excessive oiliness and greasiness over the face. So, for acne-prone patient, they should opt for a sunscreen that is gel-based or silicone-based that has a dry texture, and so that this issue is also addressed, and they have sun protection and they don't feel greasiness and excessive sweating also over their face.
Mm-hmm.
So, gel-based or silicone-based sunscreen would be advisable for those patients.
Right. So choosing the right kind of sunscreen as per your skin type, as per your work schedule is what you need. Now, doctor, as you said in brief that what are the treatment options available, we would like you to shed more light on the treatment options available for acne.
Okay. So the treatment options, as I said, depends on the severity of acne. The basic treatment would be the steps that I just enumerated: cleansing, moisturization, sunscreen, and a night gel containing a retinoid that will take care of the small bumps on the face. And apart from that, the treatment depends. If there are inflammatory acne, the red bumps, the very painful red bumps, that needs actives like benzoyl peroxide or azelaic acid, or sometimes antibiotics like clindamycin to take care of the inflammation part. Sometimes in the next stage, when there is pus formation, large pus filled nodules over the face, that needs oral antibiotics as well, like azithromycin and tetracycline group of antibiotics, and those have to be followed for a set duration of treatment, so that whatever inflammation is happening, whatever oil glands activity is happening, that is taken care of. And for even severe form of acne, there are other medicines like oral retinoids that will take care of the large cystic acne over the face. So these would be the oral medicines that help in acne. Apart from that, it depends on the cause of acne. Like if the acne is hormonal in nature, the patient needs to be given hormone regulating pills or maybe oral contraceptive pills to take care of the hormones. And if there is and there are also many, apart from the oral treatment, sometimes patient needs some procedures or some medicines that have to be injected, like if there are large cysts over the face, especially males, they tend to have very large cysts over the face, large nodular cystic kind of acne. So we need to inject medicines inside the acne so that it reduces the inflammation. And sometimes we need to go for sessions of chemical peeling, so that the oiliness of the face gets improved. There is good amount of exfoliation, and even the inflammation taken care of. So peel would be one of the treatment options. Lasers they can go for. Laser also helps in reducing the sebum content of the face, and also helps in reducing the scarring tendencies of the face. So there are multiple treatment options, and those depend on the severity of acne and the type of acne the patient is having.
Again we would like to tell our viewers कि जो भी करना है वो डॉक्टर करेंगे. आपको सिर्फ एक हेल्दी स्किन केयर रूटीन जो डॉक्टर ने बताया है वो फॉलो करना है. सेल्फ मेडिकेशन नहीं करना है. Many times it happens. The irony is कि हम से कोई कहता है कि अरे पिंपल हो रहे हैं या एक्ने हो रहा है, please go and consult the dermatologist, and they'll say कि नहीं डॉक्टर तो स्टेरॉइड्स दे देते हैं. And what they are doing, they are going over the counter buying steroids, applying it. They don't even know कि कितना यूज करना है, कब तक यूज करना है, and end up worsening the condition. तो हमें ये नहीं करना है. We need to go and consult a dermatologist. Would you like to add something to that doctor? Because I'm sure you get a number of patients saying the same thing.
We get daily these kinds of patients who have had applied some kind of steroids. Mostly Betnovit is very commonly available, and it's very common that people apply it and they don't know that it's a very potent steroid, and it has no effect at all in the treatment of acne. It will only reduce the inflammation for some days, but eventually it will increase the acne formation, and not only acne, it will have harmful effects on the in a long run on your skin. So over the counter medicines are a big no to be applied on the face.
Exactly. And when a doctor advises or prescribes you something, they know कि आपकी कंडीशन क्या है, आपकी स्किन कंडीशन क्या है, क्या प्रॉब्लम है जिसकी वजह से एक्ने या कोई अदर स्किन कंडीशन हो रहा है, और कितना डोज देना है, कब तक देना है, कैसे कम करना है. तो डॉक्टर knows all these things. They are qualified to do and advise you. So please go and consult the right person is the bottom line. We'll also pick some of our questions, some of the questions that the viewers are asking. पलक मेहरा is saying, क्या मिल्क पीने से पिंपल होते हैं? मेरी एक फ्रेंड को हुआ है.
I think,
Yes, the very first question by Pallak.
I lost you. Just a second. I cannot see the screen right now. There, yeah. Sorry. So yeah,
Okay.
as we just discussed, yes, milk and other dairy products they can increase acne formation because they influence the hormones, and hormones eventually leads to increased acne formation. So milk and other dairy products should be avoided.
ओके. सुमन यादव पूछ रही हैं, पिंपल को जड़ से खत्म करने के लिए क्या करें?
This is there is no one point. The whole talk is about treatment of pimples, and just back at home you can follow the basic skin regimens, the basic steps of skincare regimen that I just discussed about, and then consult a dermatologist, start the treatment, and believe in your dermatologist and complete the whole treatment. It might take 2 months, 3 months, and you'll definitely get improvement in your acne.
Exactly. तो अगर आपको पिंपल को जड़ से खत्म करना है तो please quickly go and consult your dermatologist before without further delaying it. Pari Sharma पूछ रही है, I got little white spots on my face after acne. I have used fluticasone on acne. I don't know this happened due to the ointment or any other reason. Please suggest. Again, a case of self-medication, over-the-counter medication.
Yeah, this is a very classical case, and fluticasone is a steroid. So steroid is a big no-no, as I just said. It's not a treatment for acne, and white spot could be anything, and this should be looked at by a dermatologist, and accordingly you should go on for your further treatment. And please avoid applying fluticasone at once. Fluticasone is not at all a treatment for acne.
परी, ऑलरेडी आप एक गलती कर चुके हो, उसके रिजल्ट्स आपको देखने को मिल रहे हैं. प्लीज इसे और ज्यादा डिले मत करिए और तुरंत जाके एक अच्छे डॉक्टर को दिखाइए, डर्मेटोलॉजिस्ट को दिखाइए और उन पे भरोसा कीजिए. ये भी बहुत जरूरी है. रांझा अरोरा पूछ रहे हैं, आई एम 18-year-old गर्ल एंड आई हैव एक्ने प्रॉब्लम्स. आई यूज नेचुरल एलोवेरा बट इट डिडंट हेल्प. व्हाट शुड आई डू?
Yeah, so aloe vera has salicylic acid properties, and it will control the sebum production. Aloe vera is okay, but aloe vera is not sufficient for the treatment of acne. So uh, they need further treatment of acne, and that depends on the severity of acne. So better to consult a dermatologist and start your treatment. Aloe vera is okay, but also take care of the further steps that you're taking in your skincare regimen, and aloe vera is not sufficient for the treatment.
Okay, so Ranja, please go and consult a doctor. Shreya Agrawal पूछ रही हैं, should I stop wearing makeup if I have acne?
Yeah, makeup has a very important effect in not only causing acne, but also it can trigger the already acne prone skin. So first of all, avoid makeup. And if at all you're using makeup, it should be water based. So any kind of oil based makeup will clog your pores, and it will further increase the acne formation. Third, always remember to remove your makeup properly before going to bed, because if you are sleeping with your makeup on, that will definitely increase the acne formation. So always wear water based makeup, and never forget to remove your makeup.
Okay. Meera पूछ रही हैं, does acne mean I'm not keeping my face clean enough?
No, it's not important. Acne is not a disease of unhygienic face. It's a disease of the oil glands, and in spite of taking very good cleanliness, you can still have acne, and it needs to be treated. That's it. That has nothing to do with the hygiene. Yeah, but that doesn't mean you can keep your you can omit the hygiene part of your face. You have to maintain a good hygiene. There is a component of infection in acne also. There is a bacteria, and hygiene of not just the face but also your hands, because we keep on touching our hands. Hygiene of the phone screen, that is also very important, because phone is everywhere and phone is on our faces. So we have to take care of hygiene, but that is not the only point. Yeah.
And that reminds me, many people have this tendency of touching their acne or touching their face with their fingers and popping up or squeezing the acne as well. There are many parlor treatments where people actually squeeze the acne. तो एक्ने से इस तरह की अगर छेड़छाड़ करते हैं तो क्या हो सकता है?
So इस छेड़छाड़ करने से, when we squeeze our acne or when we touch our acne, because the bacteria that are present in our fingers, that will get transferred on our face. So that can, first, the bacterial growth will increase. Second, when we squeeze the acne, the pilosebaceous gland, the inflammation, whatever is acne, that will increase. The amount, the oil glands, the oil that has been clogged, that will disperse out, and the acne will get worsened, the inflammation will get worsened. So it's never advisable to never squeeze your acne, never touch your face. And whenever you're applying medicine, that also you have to apply in a very light, gentle manner. Don't try to rub it in. So because all these things will further worsen your acne. So this is a very bad habit, to touch your face and to squeeze your acne. Never to do.
Fair enough. And कई लोग ये भी करते हैं, एक तो हमने बात की कि हमको हाथ से टच नहीं करना है, उंगलियों को, हाथ को साफ रखना है, मोबाइल फोन्स को क्लीन रखना है. एक डेटा कहता है कि, एक सर्वे कहता है कि हमारा टॉयलेट सीट जितना गंदा होता है उससे ज्यादा हमारा मोबाइल फोन गंदा होता है, बिकॉज आवर मोबाइल फोन इज एवरीवेयर. तो वो भी हम बार बार अपने फेस से टच करते हैं, तो उसको भी हमें क्लीन करना है. दूसरी चीज, पहले ऐसा होता था डॉक्टर कि बहुत कम प्रोडक्ट्स, कॉस्मेटिक प्रोडक्ट्स मार्केट में अवेलेबल होते थे और ऑलमोस्ट सबके घरों में वही पाए जाते थे. बट नाउ विद ऑल द मार्केटिंग गिमिक एंड so many products are there in the market and we all have almost everything. हम हर महीने एक नया प्रोडक्ट परचेज करते हैं, हम हर महीने एक्सपेरिमेंट करते हैं. Whenever, like you said, the basic skincare regimen is to have a cleanser, moisturizer, sunscreen and a serum. Depends on your skin type, but ये basic skincare regimen. But nowadays, if you go and ask somebody आपका क्या skincare routine है, they'll bring like 100 bottles and say कि ये मेरा skincare routine है, मैं कभी ये करती हूँ, कभी ये करती हूँ, कभी ये करता हूँ, कभी वो करता हूँ. Now, how far these products or number of products or the experiments that we do with our products can harm our skin, or are they okay?
So these products, especially depends on what products we are using, and never to use any product that we don't know about. We first should have proper information. If they are prescribed to us by a dermatologist, only then we should go ahead with these products, because not only the actives in the products, but sometimes the fragrances that are added to the product, or sometimes the preservatives or the binding agents that these products contain, they can worsen not only the acne, but also they can cause many kind of allergic reactions on your skin. So never to go fall for these gimmicks, and always consult a dermatologist, and whatever products they have prescribed, after assessing your skin, only those you should follow. Apart from that, try to keep your products as minimum as possible. 3-4 step regimen is sufficient. Don't go for too many products, because then you don't know which of the product is not suiting you, and then you'll have to stop all those products once at all.
Exactly. Now, स्किन के रूटीन में हमने जो अलग अलग चीजों पर बात की, क्लेंजर पे बात की, मॉइस्चराइजर पे, सनस्क्रीन पे, नाइट सीरम पे. सनस्क्रीन पे थोड़ी और इंफॉर्मेशन आपसे चाहेंगे, स्पेशली अबाउट चूजिंग द राइट SPF, चूजिंग द राइट amount of sunscreen to apply, because they say that it's equally important to apply the right kind of or right amount of sunscreen, plus reapplication कब करना है. तो सनस्क्रीन पे थोड़ा और बताइए.
So sunscreen should be applied by all, not just acne patient. Everybody should always apply a sunscreen. This should be a part of our daily skincare regimen, and it has to be applied after applying a moisturizer, and before, at least half an hour before stepping outside. And the amount of sunscreen that we should be using should be 3 finger length. 3 finger length sunscreen should be applied on the whole face, including neck. So not just the face, but also neck has to be protected from sunlight. So this should be the amount. And the texture of sunscreen depends on our requirement. So if a person has oily skin or acne prone skin, then they need a gel based or a silicone dry texture sunscreen. And for people who have dry kind of face, they can go for a bit of oily preparations. Creamy preparations would be sufficient for them. And also importantly, the effect of the sunscreen remains only for around 2 to 3 hours. So every 2 hourly, we advise them to reapply the sunscreen so that the effect of the sunscreen, it's maintained on your skin. Also, the SPF of sunscreen should be 30 or above. Uh, it's not. There are many sunscreens that will offer 40 SPF or 50 SPF. Those are good, but the effect is almost equal. So SPF 30 above is sufficient for our day-to-day activities, and that should be the SPF of our sunscreen.
Okay. And doctor, you have already told us what to avoid in case we have an acne prone skin in terms of eating or diet, right? क्या avoid करना है? लेकिन क्या हम ऐसी कुछ चीज इंक्लूड कर सकते हैं अपने डाइट में जिससे हम एक्ने को प्रिवेंट कर सके या एक हेल्दी ग्लोइंग स्किन मेंटेन कर सके?
Yeah. So as I said, that we should avoid milk, dairy products. We should avoid high glycemic foods like sugars that will increase blood sugar immediately after consuming them. We should avoid colas and fried food. Those again fall under high glycemic food category, like pizzas and burgers, especially ice creams. We should avoid all those things. And the things that we should be having more of are vegetables, green leafy vegetables, a lot of fruits, not mango, because mango is a very sweet fruit, and a lot of mango will again lead to increased acne formation. But yes,
Okay.
other fruits, green tea. Green tea has antioxidant properties. It will help in the inflammation part of acne that we should have. And yes, these omega-3 fatty acid also helps with the in reducing the inflammation in acne. So basically, and water, yes, water. We should also consume a lot of amount of water to keep on not just hydration of our skin body overall, but also to improve in the to basically dilute the toxins that build up and lead to acne formation.
Right. So very healthy, balanced diet is what we need, and hydrating ourselves is equally important. Now, doctor, before we wind up, any take-home message for our viewers?
Yeah, the take home message would be because most of the people, they were asking for home based treatment or home remedies. So take home message would be, please consult a dermatologist, because you can't treat acne at home. Yes, if you have acne prone skin, you can maintain your skin, you can prevent acne formation, but once you have developed acne, you should always consult a dermatologist, follow their complete treatment, and yes, you'll definitely get improvement.
Right. Thank you so very much, Dr. Roopal, for your valuable time. It was wonderful talking to you. We really look forward to many more such sessions in the coming times for our viewers with you. Thank you.
Thank you so much for having me. Thank you.
It was a pleasure, and thank you, viewers, for your active participation. Stay spotless, stay beautiful, and stay connected with us. Thank you. Goodbye. Good day.